Secondary mitral regurgitation is mitral regurgitation in the absence of significant structural abnormalities of the mitral valve. It can be divided into ventricular secondary mitral regurgitation and atrial secondary mitral regurgitation. Ventricular secondary MR is typically seen in heart failure with reduced ejection fraction. Dilatation of the left ventricle and displacement of the papillary muscle cause this form of secondary MR. Atrial secondary MR is often an association of heart failure with preserved ejection fraction. Reason for MR is left atrial dilatation and enlargement of the mitral annulus. It may coexist with atrial fibrillation. Assessment of severity of secondary MR may take into consideration the effective regurgitant orifice area, regurgitant volume, regurgitant fraction, width of vena contracta on the ventricular side of mitral valve, and even pulmonary venous flow. Secondary MR will have effective regurgitant orifice area more than 0.40 square centimeter, regurgitant volume more than or equal to 60 ml, and regurgitant fraction more than or equal to 50%. Among 1079 patients in the HELP-HF registry, 41.1% had moderate MR and 19.2% had severe MR. Patients with severe MR were most likely to be in hospital, present with cardiogenic shock, and with need for intravenous loop diuretics, inotropes, or vasopressors. They may have lower left ventricular ejection fraction and higher levels of natriuretic peptides. Severe MR was independently associated with increased cardiovascular death and recurrent heart failure hospitalizations.